Hi, everyone. I think we'll go ahead and get started. Well, welcome to this breakout session on psychosocial health. We're so glad that you're here. I do have a form here that I think I tried to hand out to most people, but if you didn't get a chance to grab one, you can grab one at any point or at the end of session, hoping to just get your feedback on this talk and get some of your suggestions moving forward. But I am one of the psychologists here at Children's for the Cancer and Blood Disorders Center, and I'm really excited to have the opportunity to chat with you all today about psychosocial health in cancer survivorship. So this is the plan, the general plan or overview for what we'll cover today. I'll start briefly by going over just some of the research that we know about psychosocial health in pediatric cancer survivors, caregivers, and siblings. Talk briefly about some different strategies and recommendations for supporting survivors and their families, and then go over various resources that we know are available in terms of how to find help, where to find help, both for patients, for caregivers, and siblings. And then talk about some of the resources we have available through CBDC, through the hospital, and then also in the community and online. And then hopefully we'll have a good amount of time to talk at the end about any questions that you have or any suggestions and recommendations you have for things that Children's can be doing to be supporting our survivors here. So we'll start by talking a little bit about psychosocial health in general. This is a picture that I pulled from the Leukemia and Lymphoma Society Teens Guide to Everything Cancer, which I thought really nicely depicted what a lot of our patients and survivors experience. So most people who are not going through this experience themselves think that, once you're done treatment, you celebrate, you're happy, and then you just stop thinking about cancer and everything's over, and you kind of get back to your regular life. In reality, we know that that isn't really the case. So what happens after treatment is actually really complicated, and there's lots of different things going on here. So yes, you do celebrate. Yes, there are a lot of positive emotions and excitement that comes along with that. But there's a lot of other challenges that you are still navigating. There's worrying about checkups. There's just feeling weird about what you're supposed to do next. There's trying to figure out what you do with school, with friends, with your family, managing ongoing side effects or other parts of your treatment. So this experience is really complicated. I should note as well that I will have lots of information and resources on these slides, so you're welcome to take pictures of any of these slides, and these will also be available on our website at the end, so you'll have access to all of those resources too. So before thinking about what's happening during survivorship, we know that there's a lot of adjustment that is already happening closer to the time of diagnosis and on active treatment. So patients are adjusting to just having a new cancer diagnosis, the stressors and the various demands that come with treatment in terms of chemotherapy side effects, being out of school, getting port accesses, pokes, all those different things. And often there are a lot of unexpected or unplanned events that come up as well that are unanticipated. And then just lots of impacts on multiple areas of life, be it family, friends, relationships, work, hobbies, basically every domain of life that you can think of, this can have a large impact on. Then beyond being on treatment, there's a lot of other things to adjust to once treatment is completed. Often we talk about getting back to normal or finding sort of a new normal, whatever that normal is, however that is defined. But you can probably see here this list of questions. These may be things that you all have been trying to navigate through at some point during your own journey or your family's journey. So thinking about how you fit back in with family, with friends, with school, like Dr. Bott just spoke about, there's a lot of challenges to navigate there. How are you regaining your independence and trying to build more dependence? For a lot of patients, if they're kids or teens, they are relying a lot on their parents throughout treatment, but then as they get older, they're figuring out how to regain some of that independence on their own. And then for parents, being comfortable allowing their kids and teens to develop some more independence. Building health behaviors like eating healthily, getting physical activity, sleeping well, and then also trying to find that right balance between paying attention to your body and symptoms without being overly hypervigilant and stressed about just normal changes in your body. So that's another common thing that can come up a fair bit. And then in general, just how do you process everything you've been through? I think for a lot of patients and families, as you're going through active treatment, you're just kind of in survival mode, trying to get through every day. And for some families, it's not until treatment is done when you have a little bit more time to pause and think and kind of process all of the things that have just been happening. So the research lets us know, and hopefully, this has been some of your own personal experiences as well, that survivors are generally very resilient and show positive adjustment in a lot of different areas of life. So they might experience positive outcomes related to just enhanced coping abilities. As you're faced with different stressors, you are forced to learn how to cope with a lot of those things. And a lot of patients and families report something called post-traumatic growth, which is developing growth and positive change as a result of facing a really extremely stressful or difficult situation. So there may be a lot of positive changes that patients and families might experience in terms of their own selves, their relationships with others, and their plans about the future. In one study, it was found that the vast majority of adolescent cancer survivors reported at least one positive outcome of having had cancer. Often that was related to just the way they think about life in general, or other impacts on family and friends. And then a large proportion also reported having 4 or more positive changes. So there can be a lot of really positive things that do come from a really difficult experience like this. That said, we also know that having been treated for cancer can place kids and teens and young adults at risk for various psychosocial late effects. So often we talk about physical late effects, like Dr. Chow had highlighted earlier, but there are also psychosocial late effects. And these may affect different domains such as mental health, so being at higher risk for symptoms of depression and anxiety, post-traumatic stress symptoms, difficulties with self-esteem or different behavioral challenges, social difficulties when it comes to behaving around different peers, developing and maintaining positive relationships, health-related behaviors in terms of risky health behaviors, or developing positive health behaviors, and then a variety of challenges related to academics in school or work and career, and then also cognitive late effects. Some patients may be at risk for this, which can affect their schooling and other areas of their lives. And then also just financial concerns. We know that cancer treatment has a large financial burden on a lot of patients and families. We also know that psychosocial health in survivorship is often affected by physical health, and often survivors are experiencing some late effects in terms of their physical health as well. And depending on the kind of status of physical health, that can understandably impact things like mood, anxiety, and behavior. Patients are still navigating adjustments across multiple life domains. And some common issues specific to survivorship include having fear of relapse, scanxiety, which I think is a term that has been appropriately coined, and sometimes also having experiences related to survivor's guilt. And we know that sometimes finishing treatment is actually harder than being on treatment itself in terms of the emotional impacts that that can have. A lot of patients and families might be like, we did all this, now what? What's next? And I wonder if that's the experience for some of you all as well. I want to highlight a little bit about what we know about parents and caregivers. We know that a cancer diagnosis impacts not only the patient themselves, but also the broader family and those who love and care for that patient. The research has really consistently demonstrated that parents and caregivers are both really resilient and also deeply affected by a child's cancer diagnosis. Now, similar with patients themselves, the majority of parents report positive outcomes from that cancer experience. And their distress generally decreases over time, kind of the further you are out from treatment as the years go on. But we do know that some parents experience greater distress, more worry, higher post-traumatic stress symptoms, and can also experience some strains in family relationships, financial, and work difficulties as well. One study found that severe symptoms of post-traumatic stress disorder were found in 10 to 44% of parents. I know that's a bit of a range there, but that's just to highlight that this is still a really common experience for a lot of parents and caregivers. And what do we know about siblings? So siblings, of course, are deeply affected by these experiences as well. And reassuringly, they generally show positive psychological health and can show resilience and enhanced functioning, similar with patients themselves. But we also know that some siblings can be at risk for emotional and behavioral difficulties like anxiety, depression, post-traumatic stress symptoms, as well as academic and social disruptions. These difficulties tend to occur on the earlier side around the time of diagnosis and generally tend to improve over time. But we do know that some siblings are at risk for long-term psychosocial difficulties. So knowing all of this, I wanted to shift gears next to talk about some strategies and recommendations we have to support psychosocial health among patients and families. And then after that, we'll move into talking about some different resources that we know exist that you all can access, again, to support psychosocial and mental health. So in terms of some kind of general overarching strategies that we know can help with overall adjustment, first, just expecting that adjustment will take some time. There's no kind of quick fix or easy cure to a lot of these challenges that happen, and providing yourself some time and grace to kind of find your footing again, and recognizing that with your own time and at your own pace, you'll continue to figure things out and navigate things moving forward. Also, just acknowledging, validating, and normalizing these challenges and difficult emotions for patients themselves, for parents, caregivers, for siblings, recognizing that whatever responses you are having right now are completely expected and normal and really common given everything that you have been through. Another thing that can be helpful is to help facilitate adjustment with conversation and preparation before kind of jumping back into all those usual things. So for example, for kids or teens who have been out of school or out of touch with a lot of their friends, just spending time with a few friends or maybe one good friend first can help them feel a little more comfortable and familiar before jumping into larger social settings that might be a little more overwhelming. Similarly, with the return to school, it can be helpful to meet with teachers ahead of time, or maybe meet with one or two classmates ahead of time, just to kind of touch base again prior to that full return, just to help ease that transition. And as health continues to improve, parents can also help support their kids by setting developmentally appropriate expectations and then adding in some of that extra support as needed. So for example, if you are trying to help your kids develop some more independence, there might be some different issues that you might be working on here. So helping them sleep independently, perhaps, or going places on their own, learning to order food for themselves, or brush their teeth, or take a shower on their own. So depending on their age, you might set different expectations for that, and then sort of increase those expectations with time. The same goes for household duties, like doing chores or different behaviors at home, or how much they're participating in different activities at home. Those are things that you could scale up slowly over time. And then same thing with school. Hopefully you'd be able to get some really good academic supports in place, like Dr. Bott and Dr. Leonard will be talking about. And then over time, possibly being able to scale some of those back if those aren't needed anymore. And then one other tip is just to start doing fun things or keep doing fun things in terms of just social activities, spending time with friends, being physically active, going to camps. There are a lot of really great camps that exist, and being able to celebrate and reintroduce some of those aspects of joy into life can be really important in facilitating overall adjustment. And then lastly, seeking additional help and support when it's needed. I think as parents and caregivers, there's so much that you are already doing to support your children and doing such a phenomenal job of. And sometimes it's helpful to bring in some additional mental health professionals or other supports outside of the family that can also support you all moving forward. So one other thing I wanted to highlight is this idea of health literacy, or kind of understanding your medical history and the treatment that you've been through, and helping kids and teens become more familiar with that. So Dr. Chow had presented earlier some really interesting stats about how a lot of cancer survivors are not really familiar with what they've been through, and even a small percentage didn't even know that they had cancer or didn't know the type of cancer they had. So it's really important for kids and teens to be getting familiar with this end of therapy summary that they're given in survivorship clinic, staying in touch with that survivorship team, keeping all of those notes organized in whatever organizational system that you have in place, and then over time, transitioning that knowledge as a parent to your child or teen as they're getting older. So they're becoming more and more knowledgeable about their own health care and can start to take some of that on more independently themselves. So for children who might have been treated when they were younger, developing just a really concise narrative that includes treatment essentials, like this was your diagnosis, this was, the dates that you had surgery or you had chemotherapy, just really learning the basics and helping kids learn the names of their diagnoses, their medications, and procedures can all be an important part of helping them adjust to life after treatment and continue to take good care of themselves. In terms of encouraging that independence, helping patients learn to kind of monitor their own health, schedule their own follow-up visits, or even attend those visits on their own if they're old enough, refilling prescriptions, those are all things that they can start to do on their own independently. And then also just having regular discussion about health promotion behaviors and risk behaviors are also ways that patients and teens can be learning to increase some of that independence. I've included a link here to a resource called Got Transition, and I'll highlight this a little bit later on in my presentation, but this is a really great resource, especially for teens who are starting to transition out of the pediatric healthcare system into the adult healthcare system, and has some really great resources and tips for helping with that. So next I want to talk a little bit about when to consider mental health support, both for kids and teens as well as siblings and caregivers. So up on the slide here, I've listed a few of the things that we typically look out for in terms of determining whether involving a mental health professional could be helpful. So if someone is starting to experience persistent sadness or anxiety, so these types of feelings that are there, they're hanging around a little bit longer than you want them to, they're not going away. Again, if they're having difficulty integrating with friends and peers, and these aren't just transient difficulties, but again, they're persisting a little bit longer, or someone's having a type of distress, mood difficulties, or anxiety that's really impacting their functioning or ability to kind of do their day-to-day activities, or engaging in risk behaviors. These would all be signs that involving a mental health professional or getting some additional support could be helpful. For some patients, they might experience more significant effects of their treatment that requires more extensive support. So this might be impacting academics, or if there are mobility or sensory impacts of treatment, or other medical complications that come up from treatment that require ongoing management. These might be situations where getting some additional support would be helpful. And then also if that transition support is required just to address various academic, occupational, or independent living needs. So there might be a range of people in the audience here in terms of experience with mental health support, openness to mental health support. So I wanted to highlight here some different misconceptions or thoughts that some people might have that might make them hesitant to engage in mental health services or behavioral health services. So we hear this a lot from kids and teens at Children's and elsewhere, that when we bring up the idea of a psychology referral, they're like, I don't want to do this. I don't want to be forced to talk about my feelings. I don't want someone to analyze me or judge me. Some people might think therapy won't help, or that therapy is just not for them. Maybe it's for other people, but not themselves. Or we've also heard some patients say, like, why did we get a psychology referral? Like, what did I say? Do they think I'm crazy? Like, why is this something that we're actually talking about? So I've listed here some different kind of points or language that can be used for if you're trying to encourage maybe someone to consider mental health services, or if maybe you are maybe considering it for yourself, but you have some hesitations. So first, we really like to highlight that it's really normal for people who have gone through very stressful circumstances to talk to a mental health provider or a behavioral health provider. So just really normalizing that this is something that's common and can be expected, and that we can all learn new ways of coping. We can all learn new ways of communicating with other people and working together. So it's not that something is wrong with you or like you really need the help, but everyone could potentially benefit from something like this. Sometimes we talk about a therapist or a psychologist being like a talking doctor, so someone who will talk with you about your feelings and behaviors and help try to make some of the hard things a little less hard. A therapist can teach specific skills to make life easier, to make it less uncomfortable. A therapist can help me think through and process my thoughts and feelings about what has happened in the past or what's happening now. And then I think another really important point is that patients don't need to protect mental health providers from their own sad or worried feelings. So sometimes kids may not want to talk with their parents because they want to protect their parents. They don't want them to know about some of the difficult things that they're going through. So that's when it can be helpful to have, an objective professional outside of the family where they can honestly talk about those feelings without worry about, protecting other people's own feelings. So next I'm going to run through some different supports and resources that we do have for patients, caregivers, and siblings. I'll start by talking about what we have within the hospital and then kind of move out from there. So first, just wanted to highlight this annual survivorship visit that I think many of you are already attending. Brianna Foley is our survivorship social worker who joined the team within the last year, and I think is a really wonderful resource and psychosocial support. She tries to meet with every patient or family that comes in for their visit, either in person or by telehealth. And then sometimes we also have a psychology practicum student who will also meet with patients and families during that visit. So either Brianna or one of our practicum students would be doing a psychosocial screening with patients and families as they come in. It's about a 20-minute visit where they'll ask about mood, anxiety, school and work, peer and social issues, health behaviors, kind of cover a lot of different domains. And then depending on what concerns you might bring up or identify during that visit, can provide some different recommendations and referrals for ongoing follow-up. So we're hoping that for all survivors coming through these survivorship visits, they'd have at least one point of contact with a mental health professional to check on these kinds of things. Within the Cancer and Blood Disorder Center, we have our psychology team, which has rapidly expanded a lot in the last couple years, which we are really excited about. So Dr. Joanna Patton, some of you may be familiar with her. She's a psychologist and the clinical director of our Cancer Care Psychosocial Services. Then there's also myself and Stacey Haynes, two psychologists who joined the team about a couple years ago, and then two mental health therapists, Stella and Gretchen, and then a couple practicum students who work within our psychology survivorship clinic. So we are available to meet with patients for individual therapy. Most often we are meeting with patients on active treatment, but then sometimes we'll continue to provide support into survivorship. And if there are concerns for survivors that are still very much related to their medical history, medical treatment, and cancer experience, we are available to meet with them as well. We also offer a couple behavioral health groups. We have a high school cancer group and an adolescent and young adult cancer group. We used to have a middle school life after cancer group, but unfortunately we didn't have a ton of interest in this group, so that one is on pause for now. But if we do get more interest in that in the future, hopefully that's another group that we can start again. But both the high school group and the AYA group are for patients who are either on treatment or off treatment for cancer or brain tumor, or if they've received a bone marrow transplant. It is 8 group sessions, so weekly sessions that are all by Zoom right now, and we offer 2 cycles of these, so one in the fall across September and October, and then one in the spring around the months of May and June. And I think these can be really great groups because a lot of patients have never really had the chance to be in the same room or even meet another person with cancer or another cancer survivor. So for the group members who show up to this, the structure of the group is pretty fluid. So it's not like really a structured week by week intervention that they go through, but it's more sort of a safe space for patients and survivors to meet each other, to give support, receive support, and then talk about different topics that may be relevant, if it's issues with family or friends or dating or school or chemo brain, all of those things. And there's a couple group leaders who help facilitate those conversations. And I think this has been a really wonderful resource, and we've gotten some really great feedback about how helpful and instrumental these groups have been in supporting patients throughout their own journey. So if you're interested in either of these, you can talk with your survivorship provider, anyone on your team, and get a referral in. We're just in the midst of our fall group right now, so you could probably join still some of the later sessions this fall, or if you're interested in the spring, that would be another option. And these are things that we continue to offer every year. We also have a couple art therapy groups that are led by Helena, one of our amazing art therapists. So there's one group on Mondays from 4 to 5. It's called Art and Heart Space, and this is both for patients and their siblings. It's done virtually at this time right now. Hopefully some of these can transition to in person, but we know Zoom is also really helpful just for increasing access. And then there's another group called Ink About It. This is also on Monday evenings, and this one is specifically for siblings. So if you're interested in either of those groups, Helena's contact information is there, and there's a link that you can use to sign up as well. We also have a cancer survivorship photo voice project that Brianna is starting up in November. So the goal of this group is to use photography as a form of self-expression. So any patients who've been treated for cancer and are interested in this type of project are welcome to attend. The group starts on November 7th at 6:30, and it's going to be six sessions, and this is geared towards teens ages 16 and up. We have a bunch of different camps. I have a messy looking table here, so I don't expect you to be able to read all of this, but there's camps like Camp Good Times, both for patients and for siblings, Camp Agape, Camp Make a Dream. There's a lot of really wonderful resources that, again, your social worker or survivorship team can give you more information about. But these camps, I think, can just be a lot of fun for patients and their siblings, just to kind of be around other kids and have a lot of fun and just enjoy their time kind of re-experiencing childhood in that way. So we've got information available for those if you're interested. And then next I wanted to highlight some of the other mental health services that we have available through the Seattle Children's Psychiatry and Behavioral Medicine Division. So this isn't specific to cancer, but we have a number of different outpatient specialty clinics that address various mental health challenges. So we have a mood and anxiety program, the Pearl Clinic, which is for ADHD and disruptive behaviors. You can read, some of the other ones we have here. All of that information is available on our website, and is another way that we're trying to provide kind of increased access to mental health care. And then we have a couple of clinics that are meant for kind of higher levels of care, some intensive outpatient programs for OCD, and then we also have a partial hospitalization program for adolescents who are experiencing some more acute issues. And then also our psychiatry team can offer medication evaluations. That said, sort of the caveat here is there are pretty long wait lists for a lot of these services that we do offer. So I think while they are a great resource, it can take a while for patients and families to access the care that they're actually looking for. So there are a lot of community resources as well that we often encourage families to try to connect with, as that might be sort of a speedier way to get the care that you're looking for. We also know that navigating mental health care in the state of Washington is really complicated and complex and confusing and frustrating. So we have some resources to try to help families connect with that care a little more easily. So there is one class that's offered through Children's. It's a Zoom class just for 30 minutes that's meant to help families kind of learn how to navigate that system, especially if you're looking for mental health or behavioral health services and are feeling a little lost or overwhelmed about where to start. So this is a Zoom class. It's free. You just register in advance. It's available in both English and Spanish, and recordings are also available online afterwards. And there's 2 different classes. So the first class, part 1, just talks about how to access outpatient services. And the second class, if you're interested and feel like it's relevant for your family, talks about how to access higher levels of care for kids and teens who might need some more kind of intensive services. And then parents and caregivers can also learn about ways just to advocate for that care for their kids. I also wanted to highlight the Washington Mental Health Referral Service for children and teens. Some of you might be familiar with this, some of you may not be, as it's relatively newer. But this is a really great service that is free and available to all people in Washington to help locate and access mental health services for kids and teens. So the way this works is you basically call this number, or you can submit a form online. The number is available just during regular business hours, and it's for children and teens up until the age of 17. So you call in and schedule an intake with a referral specialist and just briefly go over what types of mental health concerns or needs that you have, where you're located, and what your insurance is. And then that referral specialist will take that information and then give you a call within a couple weeks after they identify 1 to 2 providers who take your insurance and have upcoming openings. And then they will also follow up with you afterwards to problem solve any barriers that you might come across in accessing care. So this is usually one of the go-to resources that we will provide to families when they're trying to find a therapist or a mental health provider. There are also a number of different therapist directories that you can go to yourself just to find someone. Again, there's different filters that you can enter, your insurance, your child's age, kind of what are the presenting problems, if you prefer a certain gender for a therapist, any different factors that you might prefer. You just kind of plug that in, and then it'll give you some different options for people in the area with upcoming openings. Wanted to highlight a couple resources at the bottom here for BIPOC mental health providers, and then a therapist directory for inclusive therapists who identify themselves as having a marginalized identity and really focus on providing inclusive, affirming care. So if there are particular identities that you hold and feel like you'd like a therapist who is able to celebrate that and understand that, those are a couple resources that could be a good place to check out. Then, of course, wanted to highlight Cancer Lifeline, and they've got a table out at the back, so you can chat with them today as well. They offer a number of really great mental health support resources for patients and caregivers, both through individual therapy and group therapy, different classes. So we like to partner with them a fair bit on different programming, and are often, referring some of our patients and families to them. I wanted to highlight a few things about just choosing a mental health provider and what to look for when considering a therapist. So first, there's a few just, logistics and basics on whether they take your insurance, are they taking new patients, do they do in-person or virtual visits, what time slots do they have available, do you need something after school, do they do kind of weekend or evening appointments, just sort of the basics there. But beyond that, it's also important to know a little bit more about their own qualifications. So you want to know whether that therapist is licensed. Their particular degree may not necessarily hold as much weight. I mean, those are things to consider. You could have a licensed psychologist, a licensed mental health therapist, a licensed clinical social worker, who all have various different types of training, but can all be very well qualified to work with you and provide good care. You also want to ask about what types of treatments they provide and whether those treatments have been shown to work for that particular presenting problem. So we know that not all treatments are as effective as each other. So the website that I've included here, effectivechildtherapy.org, I think is a really helpful resource for families. You can go there and learn about what are the evidence-based treatments for a particular issue. So if you're dealing with anxiety, or you're dealing with depression, or dealing with behavioral issues, this will let you know, cognitive behavioral therapy, for example, has been shown to be effective in treating this problem, or trauma-focused trauma-focused cognitive behavioral therapy is been shown by the research to be an evidence-based treatment for trauma. So knowing what types of treatments therapists are providing is also really important. It can also be helpful to ask a little bit more about their experience, if they have specialized training in working with kids and teens specifically, if they have experience working with youth who have a history of cancer or medical conditions, and considering how important that might be for you, and just their familiarity with dealing with similar challenges that your particular kid or teen or yourself are dealing with. And then lastly, just trying to determine whether that therapist is a good fit for you. Sometimes it may take a little while to find the right provider that you feel you can really connect with and make good progress with, but you can ask yourself questions, or your kid or teen can ask themselves questions about whether they feel comfortable with that person, whether you feel like they, have the skills and the experience to help you make progress in your own goals. And then also recognizing that this process can take some time, and I recognize that can be really frustrating and stressful for a lot of families. Sometimes you may need to make multiple phone calls or send multiple emails and follow up, but just stay persistent with that, because we know that getting that support is really important if it's needed. And then there's a couple links here that just have some additional tips for selecting a psychologist or a mental health provider. And then for some patients, it's also helpful to access medication support for mood, anxiety, or ADHD or other concerns. It can be really hard to find a psychiatrist here in Seattle or in Washington, but there's a new resource called the Washington Partnership Access Line, where any pediatrician or primary care provider can call this number Monday through Friday and consult with a child psychiatrist through Children's. So this is a really helpful resource that will often kind of direct patients and their primary care providers to. I wanted to highlight a few just kind of cancer-specific resources. This is a website through the NIH that has compiled a ton of really great psychosocial information for kids, for parents, for siblings. So the link is there. You can kind of navigate, towards the links that might be more relevant for you, but there's tons of great resources, books, videos, different therapeutic resources that are just available to the public. Both St. Jude and the Children's Hospital of Philadelphia also have some really great resources on their websites that include recommendations for, books, podcasts, different tips for study skills, memory, attention, sleep, those kinds of things. So definitely encourage checking out some of those websites. This is a manual from the Children's Hospital of Philadelphia that is really comprehensive, that includes psychosocial services for adolescents and young adults who are survivors of cancer. So you can see, hopefully in this table of contents, it covers things like 504 plans, IEPs, planning for educational future, financial things, insurance things, digital health tools, podcasts, tips on sleep and being active. Some of these resources are specific to CHOP and to sort of the East Coast, but there are a lot of other resources that they reference here that are kind of available nationally. I'm hoping one day at Seattle Children's we can kind of mirror something like this and create something specific to Seattle and Washington locally, but for now would direct you to this really great resource. There are a number of different organizations that support adolescents and young adults with cancer specifically. I don't know how many of you are familiar with the Cancer Patient Instagram account, but if you appreciate dark humor or satire, I think a lot of our patients and staff at Children's get some good laughs from following this account, which really depicts the cancer experience in really poignant and humorous ways. Elephants and Tea is another great organization. Stupid Cancer is another great organization that's really aimed at empowering adolescents and young adults with cancer. Escape is another organization that is aimed at supporting LGBTQ AYAs with cancer and provides monthly virtual meetups for them in various events. And then there's a number of different camps that are listed here as well. Got Transition is the resource I referred to a little bit earlier that is aimed to improve transition from pediatric to adult healthcare systems. So there's a lot of great kind of tips and resources and strategies on this website, both for youth and young adults themselves, as well as parents and caregivers. We know that transition from children's to Fred Hutch or just pediatric care to adult health care can feel really complicated and complex to navigate, but there are resources to help support that transition. And like Dr. Chow was saying, kind of starting to talk about that earlier, around the age of 14 or just earlier in adolescence, can help teens kind of prepare for that eventual transition. There are a lot of just general mental health resources that are available on the Seattle Children's website, so you can access those there. There's something called the First Approach Skills Training Program, which is also available through Seattle Children's. This has a number of just free downloadable handouts and workbooks that you can use yourself just to kind of work through if you feel like you either don't need or aren't ready for meeting with a mental health provider and just want to try to work on some of these skills on your own. So there's different workbooks that address anxiety, depression, behavior, some of these other issues that I've listed here. Here's just an example of what one of those handouts might look like. So this is a handout on anxiety for teens. It just provides a little information about what anxiety is and then goes through some different tips and strategies that you can use on your own to start to manage that. This is an example of what one of the handouts looks like for caregivers who might have a child or teen with anxiety, provides some different tips and strategies on things that you could do as parents and caregivers to support your kid as they're learning to practice some different coping skills to address worry and anxiety. So yeah, definitely a great resource that's, again, available to the public. This is another resource. I know I'm hitting you with so many resources, but again, you'll have access to these slides later. Infoaboutkids.org is a collaboration for the Consortium of Science-Based Information on Children, Youth, and Families. We know it can be hard to know where to look for really reliable information. So this is a site that's sort of centralized, that compiles a lot of that science-based, evidence-based information and addresses lots of different medical conditions as well as behavioral and mental health concerns. Next, I wanted to highlight a few resources for caregivers. Like I mentioned earlier, a lot of caregivers and parents are very resilient, and a number of them also could benefit from some additional emotional and psychological support, even well into survivorship. So there's a caregiver well-being group. This is a group formed by a number of pediatric psychologists nationally and internationally who are just dedicated to supporting caregiver mental health. So I've included the website and their Instagram page here. Tons of resources for caregivers, lots of helpful handouts with practical tips on self-care and accessing other supports for yourselves. Cancer Lifeline, Cancer Pathways, both offer support for parents and caregivers. The Courageous Parents Network is another organization that supports parents of children with medical conditions, and that's another, I think, great organization that you could check out as well. And then I've included a couple links with just some general, tips and self-help resources that you can also access. Momcology, or the Connections program, is a new program that we are offering at Seattle Children's. This is a national nonprofit organization that was actually started by parents of children going through cancer treatment with the goal of offering support to other parents and partnering with a specific hospital to do that. So we just launched our Connections program this fall, and these will be bi-monthly support groups for any caregivers of children with cancer. So it's not just for moms, it's for dads, for any other caregivers, and it's facilitated by our social workers at Seattle Children's, and Megan Robbins is our contact for that, so feel free to reach out to her if that's something you're interested in. And then there's also a caregiver support group that's offered through Cancer Lifeline, and you can probably chat with them later at their booth. This is facilitated by Marcia, who's a licensed social worker, and they meet every third Tuesday late afternoon, and those upcoming dates are included there. And then lastly, I just wanted to highlight some supports for siblings as well. So if a sibling you feel could benefit from some additional behavioral or mental health support, I would encourage you to look at that Washington Mental Health Referral Service, get them connected with an individual provider. Cancer Lifeline also provides support to siblings. We have those art therapy groups at Seattle Children's, some that are geared for patients and siblings, and then some just for siblings specifically. And then also really encourage considering camps, as we know siblings can have a lot of fun with that as well. So those are all of the resources I have for you. I know that was a lot, but hopefully that provides sort of an overview of some of the different things that are available to support you and your family throughout this journey. And I'm happy to take any questions or comments or reflections that anyone has. Could I have you maybe speak into a mic?
Do you want to come back? No? Okay. All right. Is this turned on?
Yeah.
Yeah, okay. I have a question about the part of the presentation when you were talking about increasing health literacy. And, how do you do this? And how much should you do this? Your child, when they've finished with their cancer treatment, they're finally living a life where they're free and, relaxed, and sometimes my kid forgets he ever had cancer, but yet there's this thing in me that I've told him before: got to eat healthy, we've got to be careful, you have got to wear your sunblock, all of these things. And so without being like this constant presence of like, you better do this or else it's going to come back, how do you walk that line? Because I want to let him just live his life like everybody else does. And I know my other kids need to wear sunblock too, but he really needs to wear sunblock, and he really needs to make sure he eats healthy. How do you do that?
Yeah, I think that's a great question, and I imagine that a lot of other people are facing these similar issues. So I think one thing to consider is just, your child's development and their age, and recognizing that maybe as they're getting older, you may be able to kind of increase more of that teaching over time, but recognize that is a really fine, delicate balance and dance to be doing. I think going to those annual survivorship visits could be a really good place to start, where at least some of that information is coming from a medical provider, and then you can kind of reinforce some of that as well. But that would be at least one kind of touch point on an annual basis to do that. But recognize that, yeah, there's a lot of challenges and considerations around that. And depending how, I guess, plugged in you are still with Children's and your survivorship team or other healthcare teams, I think these are some things that you could also bring to your visits, and they could continue to kind of talk about some of those things with you to provide some more guidance. But thanks for bringing that up. I think that's a really important challenge.
And one other question. If your child has some of these psychosocial problems, when do you know that it's a result of the treatment, and when it's just that's regardless, that's how it would have been? And does it matter?
Mm-hmm. Yeah, I think that's a great question, and so many families have that same question as well. So I think to an extent it can be helpful to know where some of these challenges are originating from. But to your second point, sometimes it may not necessarily matter that much in terms of the interventions that they actually need. So we know that the types of treatments that are effective, for example, for anxiety or depression, they're kind of the same regardless of where that is originating from. And typically, a pediatric psychologist or a therapist who has some experience working with kids with medical illnesses are adapting some of those treatments depending on what that kid has been through. So the interventions themselves, or the supports themselves, may not necessarily change. They just might be kind of, tweaked or modified to support that individual child.
Okay, thank you.
Yeah.
Just a quick clarifying question. Where will we find access to these amazing resource slots?
So I think, and I don't know if anyone from the event is here, I think it should be on the website that you went to register for the event. I don't know if someone can clarify that. That's a thumbs up. Mm-hmm.
My son went through treatment as a toddler, and he's almost 5 now. But as an educator, I have a lot of training in ACEs, and I know that these things can come back in the future. He can be seeming to cope with it just fine now, but I don't know what it's going to look like in a few years and as he starts school. We're not quite to survivorship yet, and as much as I love his team, this is the one area I feel like there's not a lot of, they just keep saying he seems like he's doing great and he's really young. So are there resources, or do you have any suggestions for what to do with these preschool age kids who have been through something so traumatic?
Mm-hmm. Yeah, that's a great
Everything
question.
says 8 and up, or all these groups are for they're for older kids. And so I just want to be proactive and make sure we're preventing anything from coming up.
Yeah, so I think that's a great point, and hopefully this is something we can kind of develop moving forward here at Children's, some more programming for our younger kids as well. I would say, at this point, these are things that you just want to be monitoring with your own kids, right? So if right now they're doing great, that's great. We're not going to, go looking for problems per se, but you know what types of things to be looking out for, and if and when they do come up, it sounds like you'll be ready to kind of proactively address those types of things. But I think for now, you're just kind of doing what you can to, support their transition back into those regular routines, that normalcy, getting back into, preschool, school. There is one of the FAST programs. There's one that's geared towards young kids. So I would encourage you to maybe check that out for some tips for just supporting healthy child development at that younger age. But similarly, I think once you get to survivorship, or as you're checking in with your medical team, bringing up any issues around mood and coping so that we can intervene early as needed. Yeah. Thanks for sharing that. So we only have, I think, about 5 minutes until the next breakout session, and want to make sure you have time to transition. I know we have one more question. So if you all get a chance to just quickly fill out that survey, if you have any other ideas or feedback for psychosocial programming at Children's, we'd love to hear that. You can just drop off those forms at the front here. And while you're doing that, I'm happy to take one more question.
I have a child who has anxiety, like ongoing anxiety, and she said that's okay to share. But how do I interact with her medical care team in a way that they don't blame all of her symptoms on her anxiety, especially if you have a very symptomatic kid that has other health diagnoses? We even had an experience last fall where I came and I said, there's something else wrong right now. We need to do tests and everything, and just had a really heated argument, basically, and I left crying. The next day, she was admitted to the hospital for 2 weeks and had to have surgery. So it's like, I know anxiety can cause all kinds of issues, so how do we help the care team know that, as a parent, oftentimes we know what's, due to anxiety and what's typical for them. So how do we kind of communicate that, and is that something other people have had to deal with?
Yeah, I'm so sorry to hear that's been your experience. I think the answer to that is really for us as healthcare providers to do better and to put certain biases aside and do a better job in some situations of listening to parents and caregivers. I know there's lots of other considerations that come into place in those situations, but I'd say for now, just continuing to advocate for your child as best as you can, recognizing that you have a lot of knowledge and are experts in your child in some ways, and then the medical team is experts in other ways, and hopefully teams can work together to partner with you and take into account your observations, which are really important. All right. Well, thanks so much for your time, everyone. And yeah, just feel free to drop off those forms at the front here.